Listen-only mode. Hello and welcome to today's webinar. I am Trevor. I'm Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, which continues the spring leg of our 2024 series. If you're new to our webinar, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers and the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. Now, this webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides provided with this presentation. And we will have a quick Q&A session at the end, but if you would like, please put your questions in the chat function of GoToWebinar on the side. Now, our presenter today, Sienna Van Duzen, is the Advocacy Manager of Prevention and Early Detection at the Canadian Cancer Society. She serendipitously stumbled into advocacy 10 years ago and is passionate about inspiring meaningful change to improve the well-being of those living across Canada and beyond. Prior to joining CCS, Sienna conducted public, government, and stakeholder relations, communications, and engagements in sectors including health, international cooperation, and agriculture and agri-foods. Sienna holds a Master of Business Administration from the University of Ottawa and a Bachelor of Arts in Communication from Wilfrid Laurier University. And so without any further ado, I'm going to hand it over to Sienna for her webinar, The Link Between Alcohol and Cancer.
Thank you so much, Trevor, to you, the Canadian Cancer Survivor Network, and to all of you listening today for your interest in learning more about the link between alcohol and cancer risk. My name is Sienna Van Duzen, and I am the Advocacy Manager of Prevention and Early Detection at the Canadian Cancer Society. And I'll have you go to the next slide there, Trevor, for me. That's me. And today we're going to take a look at what we know about alcohol and cancer risk and discuss what the Canadian Cancer Society is doing to raise awareness and reduce the costs and harms of alcohol. We'll also discuss how this relates to you and what you can do to learn more and/or to get involved. But first, I'd like to start with a few questions. And you can think about this, you can write the answers in the chat. Either way, I'd like you to reflect on what percentage of people in Canada 15 years and over you think report consuming alcohol in the past year. And like it might be 55%, 75, 95. Think about that. I'd also like you to consider how many adults across Canada you think consume one alcoholic drink or more a day, whether that's 2 in 10, 4 in 10, 6 in 10, or 8 in 10. And I'll have you hold on to those thoughts as we move to the next slide. There we go. So alcohol is one of the most widely used psychoactive substances along with caffeine and nicotine. We know that in 2019, about 75% of people in Canada 15 years and over reported consuming alcoholic beverages in the previous year. While this number may be higher than some thought, it may also be lower than others anticipated. As we conduct work on alcohol consumption, we like to keep in mind that about 25%, or almost a quarter of the adult population in Canada, is choosing not to consume alcohol. It's therefore interesting to consider the ways in which our public spaces and social gatherings can actually be made more inclusive by reducing the emphasis on drinking alcohol. When asked a similar question for a large data survey, about 2 out of 10 adults in Canada reported consuming one alcoholic drink or more a day. Despite this number perhaps seeming small, it equates to over 7 million people across our country. I also think it's interesting to reflect upon the role our media and alcohol marketing play in making alcohol seem like it's being consumed by everyone, everywhere, all the time, which in turn influences public behavior. I'll note that both these numbers were from data collected before the COVID-19 pandemic. And during a pulse check in May 2020, close to 1 in 5 people in Canada, almost 20% said that their consumption of alcohol had increased because of the pandemic. We await data to determine whether these consumption levels continue to be maintained. It's also known that people in Canada often underreport and underestimate how much they drink by up to 75%, which suggests that these numbers could be a little bit low. As we go to the next slide, I'd like you to think about alcohol as a modifiable cancer risk factor. And so alcohol isn't known to increase the risk of all cancer types, but it is classified as a group 1 carcinogen, which means it's a cancer-causing substance. Alcohol is estimated to be one of the top 3 causes of cancer deaths worldwide, and evidence indicates that regular alcohol consumption of any type, be that wine, beer, or spirits, over time, and even at low levels, increases the risk of developing at least 9 different cancers, which are shown in the image on this slide. This is because the type of alcohol in an alcoholic beverage is ethanol, which our bodies break down into acetaldehyde. Both ethanol and acetaldehyde are known to increase cancer risk in humans. Acetaldehyde has also been shown to damage our DNA and stop our cells from repairing damage. Alcohol can also affect hormone levels like estrogen, which explains its ability to increase breast cancer risk. This anatomical figure stands out to me for 3 reasons. First, because breast and colorectal cancers remain among the most commonly diagnosed cancers in Canada in 2023. Second, cancer cases among people under 50 have been on the rise in many parts of the world. Cancer is causing the most disease and death in this younger age group include breast, stomach, and colorectal cancers, and research suggests that tobacco, alcohol, and obesity are key factors behind this increase. Lastly, low survival cancers include cancers of the pancreas, esophagus, liver, and stomach, the risk of all of which increase with alcohol consumption. I do need to pause here to acknowledge that about 4 in 10 cancer cases can be prevented through healthy living and policies that protect the health of people in Canada. And that's what we're talking about today. However, this does mean that about 6 in 10 cancer cases cannot be prevented. Under no circumstances should people be blamed, shamed, or stigmatized for receiving a cancer diagnosis. Our efforts in prevention are about creating healthier environments that help reduce cancer risk and preventable cancer cases. But all of this begs the question, if people better understood the extent to which alcohol is a key modifiable cancer risk factor for some of the most common and increasing cancers, particularly among younger people, as well as some of the least easily treated cancers, might they be empowered to make different decisions for their health? Moving to the next slide, we're going to look at the intensity and duration of alcohol consumption and how that impacts different cancer types in different ways. So cancer risk increases most among those consuming 4 or more alcoholic beverages in a day, and those consuming 1 to 4 alcoholic beverages a day. But even those consuming no more than 1 alcoholic drink a day are at risk. So again, moving to the next slide and looking at some overarching trends and where we're headed, data from the World Health Organization suggests that people in Canada consume alcohol at a per capita basis for far greater than the global average at 9 liters compared to 6 liters per year, which is significant. We also know that alcohol consumption varies across a variety of factors, including sex, age, sexual orientation, socioeconomic status, indigeneity, and even jurisdictions. In 2015, an estimated 3,300 new cancer cases diagnosed in Canada were due to alcohol consumption, which is almost 2% of all cancer cases that year. Carrying on to the next slide. Prior to the pandemic, trends indicated that the number of people consuming alcohol at a moderate risk level were increasing, while the number of people abstaining or drinking alcohol at low risk levels were decreasing, with those consuming alcohol at high risk levels remaining stable. If this trend continues, the number of new cancer cases due to drinking alcohol is expected to triple, increasing from 3,300 in 2015 to over 10,000 in 2042. Again, time will tell how changes in behavior during and since the COVID-19 pandemic may influence these numbers. Next slide. However, with these concerning numbers comes great opportunity. The top green line here shows that if everyone who currently consumes more than 1 alcoholic drink per day reduced the number of alcoholic beverages they consume by 1, we could prevent almost 4,800 cancer cases in 2042 and prevent over 68,000 cancer cases between 2018 and 2042. Furthermore, a 25% reduction in alcohol consumption prevalence among people in Canada from 2020 to 2032 could prevent 10,300 cancer cases and save $940 million in cancer management costs between 2032 and 2044. These statistics demonstrate the extent to which incremental changes in our collective behavior has the potential to have huge positive impact on our healthcare system and the health of people across Canada. Again, I'd like you to just think to yourself, and if you're being honest, I'd like you to reflect on whether or not you knew before today about the link between alcohol and cancer. Because if you didn't, you're certainly not alone. We'll move to the next slide. Despite there being over 30 years of research on the link between alcohol and cancer risk, public awareness remains relatively low. New data from a CareX Canada and Canadian Cancer Society research project shows that today, over 40% of people in Canada remain unaware that alcohol consumption increases the risk of cancer. This is important because we believe people in Canada have a right to clear and accessible information about the health and safety of the products they buy so they can make informed decisions for their health. More on this in a moment. But on to the next slide. In 2020, the Canadian Centre on Substance Use and Addiction began a new project to update Canada's low-risk alcohol drinking guidelines. It is a bit of a mouthful, but recognizing new evidence on alcohol-related mortality and morbidity, as well as a better understanding of how alcohol contributes to social harms. Through this process, consultation participants ranked the impact of drinking alcohol on physical health, such as the link between alcohol and cancer, as the second highest priority for guideline updates after mental health, demonstrating the importance and relevance of the work we're doing at the Canadian Cancer Society and together in our cancer community at large. Despite some misrepresentations in the media, Canada's new guidance on alcohol and health emphasizes that consuming less alcohol is better. Rather than specifying how much is a safe or unsafe limit to consume, the guidance looks at a continuum of risk. But even the high risk category on the continuum is significantly less than previous low risk drinking guidelines, which continues to spur public reaction. This update is important because it reflects the best evidence available today, as well as unique perspective of people in Canada. It also reminds us that cancer is but 9 of over 200 health conditions and diseases related to the consumption of alcohol. Next slide. When we broaden our scope to look at alcohol and health in general, alcohol is directly linked to over 800,000 emergency room and hospital visits and 17,000 deaths across Canada every single year. Alcohol costs $19.7 billion, again, every year in healthcare, lost productivity, criminal justice, and other direct costs. Despite popular belief, this is less than the money the government makes from the sale of alcohol via taxes. When considering both governmental revenues and societal costs, Canada is running an alcohol deficit of about $6.2 billion per year. Next slide. Alarmingly, alcohol accounts for about 40% of the overall cost of substance use in Canada, which you can see here is more than the cost for opioids, cannabis, and cocaine combined. Alcohol is also responsible for the most productive years of life lost alongside opioids as of 2020, the most hospital stays, and the most emergency department visits. 19% of total alcohol costs are driven by healthcare costs, which includes the cost of physicians and prescription drugs. With all of this research, cancer-specific and general health, it becomes quickly apparent that it is collectively costing us significantly, economically and socially, to uphold our current relationship with alcohol. Next slide. Last year, the Canadian Cancer Society updated our own alcohol recommendation, which you can read here on this slide. The first part continues to emphasize the limiting of alcohol as well as referring to Canada's guidance on alcohol and health as a tool to help people make an informed decision on whether to drink and how much. Our recommendation invites people in Canada, wherever you're at and without blame, shame, or stigmatization, to be mindful of their alcohol consumption and reduce the number of alcoholic beverages they consume whenever and in whichever ways they feel are good for them. While the idea of reducing our alcohol consumption can be stressful, it is uplifting to know that about 60% of people in Canada already report drinking less than 2 alcoholic beverages a week, which falls within the low risk category of Canada's guidance on alcohol and health. So while there's lots of work to be done, we're certainly on our way. Next slide. The Canadian Cancer Society is committed to increasing awareness about the link between alcohol and cancer, and as an important first step towards changing attitudes and behaviors. Right now, we do this in a variety of ways, including several pages on our website at cancer.ca. There's a tool, It's My Life, which is online and it's interactive. It covers cancer prevention in general, but it also includes alcohol consumption. Prevention programs, including Better Women, which is a health promoting program that offers women free access to a volunteer peer health coach who is trained to help them reach and maintain their health and cancer screening goals, including reducing alcohol consumption if they so choose. We also have a fundraiser, Dry Feb, that challenges people across Canada every year to go alcohol free in February and raise funds for the Canadian Cancer Society. It's really encouraging that about 75% of Dry Feb participants say they'll drink less alcohol after participating in the campaign, while the rest say they'll drink about the same amount. This demonstrates that people are feeling the benefit of reducing their alcohol consumption and want to continue throughout the rest of the year, which is really great. Almost 15,000 people participated in this event this year alone. If you're interested in joining us next February, you can find out more or register at dryfeb.ca. Next slide. We also launched in 2023 our alcohol policy position that states our commitment to advocating for stronger policies that reduce the alcohol consumption of people in Canada and increase their awareness about the risk of cancer related to alcohol consumption. To start, the Canadian Cancer Society is calling on the federal government to implement mandatory labels, including warnings with health and safety messaging on all alcoholic products sold in Canada. These labels should include standard drink information, nutrition labeling, risk for cancer and other chronic diseases, and Canada's guidance on alcohol and health. It's also interesting to note that there's been movement on this in the Senate and in the House of Commons, and so you might have heard about this in the news and in other spaces and conversations, and it would be a really great first step. We also believe provinces and territories have a responsibility to implement mandatory health and safety messaging requirements, including the risk for cancer and other chronic disease related to alcohol consumption at any outlet where alcohol is sold. Next slide. Diving in a bit more at alcohol warning labels, there was a first of its kind scientific study that took place here in Canada in the Yukon in 2017 that was led by Aaron Hoban and Tim Stockwell from Public Health Ontario and the Canadian Institute for Substance Use Research, respectively. This project tested the effectiveness of alcohol warning labels and, despite being disrupted by lobbying efforts from the alcohol industry, successfully demonstrated that people remembered what the labels said, that they talked about the labels, and that consumers decided to drink less as both alcohol sales and consumption went down. It's because of studies like this that we know that warning labels on alcohol products can help inform the public about the risks of alcohol consumption, including cancer risk. Alcohol labeling, along with continued education, will ensure that more people in Canada can make informed decisions for their health. Next slide. Most recently, a Canadian Cancer Society study that we funded, also led by Dr. Aaron Hoban, found that cancer warning labels on alcohol products appear to be associated with lower product appeal, higher perceived health risks, and reduced consumption intentions, even in the presence of nutrient content claims such as zero sugar. This study contributes to the body of evidence that health warning labels can effectively inform the public about alcohol consumption and cancer risk and potentially reduce alcohol consumption in the population. Furthermore, recent polling we conducted across Canada indicated large public support for measures, including 8 in 10 people in Canada supported the implementation of warning labels or health messaging on alcohol products as a strategy to raise awareness of health risks and cancer. 8 in 10 supported including nutrition facts tables on alcoholic beverages, and 9 in 10 supported standard drink labeling to increase awareness about standard drink sizes. Next slide. If you haven't yet made the connection, there are many parallels between what our society is going through today with alcohol and what was experienced 50 plus years ago with tobacco. Tobacco was widely encouraged before its health harms were more thoroughly understood, and the change has taken place over decades. Our team sees this as an exciting chance to drastically change population health for the better in matters related to cancer, but also across 200 plus other health conditions, including liver cirrhosis, cardiovascular disease, mental health, and other chronic health issues. This is a big problem that will require more than one solution, tailored to many different audiences. And we're really grateful for those who are open-minded and willing to explore them with us. Next slide. The Canadian Cancer Society is committed to our role on this issue and is a champion for people living with and beyond cancer. But nothing gets solved alone by one person or one organization. And if you're looking for more information or opportunities to take action, we invite you to visit cancer.ca, particularly our pages on alcohol policy, limiting alcohol, and sobering facts about alcohol and cancer risk. To join us next February as we reevaluate our relationship with alcohol, raise awareness about the link between cancer risk and alcohol, and promote the idea that we can modify our alcohol consumption to reduce cancer risk. You can also see Canada's guidance on alcohol and health for broader implications of alcohol consumption on overall health, or join the Canadian Alcohol Policy Evaluation Community of Practice, which is hosted by the Canadian Institute for Substance Use Research, which is a national alcohol policy community that helps build and sustain long-term connections, collaborations, and form professional development between individuals from a variety of government and non-government sectors with the shared goal of promoting healthy public policy in relation to alcohol. Lastly, you can email me, Sienna, at sienna.duzen@cancer.ca to connect and or be added to Canadian Cancer Society's contact list for periodic emails about our advocacy efforts on alcohol policy. There tends to be a couple a year, and we've got a nice group going. Next slide, please. I really can't wrap up without acknowledging that each of our circumstances, experiences, and relationships with alcohol are different and that we may need different supports. The Canadian Cancer Society offers a variety of tips and tricks to help reduce alcohol consumption, but for more support, we encourage you to explore resources including Wellness Together Canada, which is Health Canada's free online resources, tools, apps, and information to support individuals navigating mental health and substance use. The Canadian Centre on Substance Use and Addictions provides a list of addictions treatment helplines in provinces and territories across Canada. And finding quality addiction care in Canada is a guide developed by the Canadian Centre on Substance Use and Addiction, the Canadian Executive Council on Addictions, and the Government of Alberta to help people make informed decisions when seeking substance use treatments for themselves or other loved ones. We hope these tools are helpful in getting the right services to the right people so we can all thrive in a world with a little less negativity like impacted by alcohol and cancer. I'm going to wrap up for now and thank you for your time and attention. I know that usually when we have conversations about this, there's tons of discussion and questions. So I'd really encourage you to put them in the chat and turn it over to you and hear more what you want to hear about on this issue, even what you're thinking about or some reflections.
Well, thank you very much for that for the presentation. It was very eye-opening. My first, and once again, any questions that you guys have, just put them in the questions tab on the GoToWebinar menu on the side here. My first question has to do actually with the labels themselves that were put onto the alcoholic cans. In the research, did they vary in size at all? Because I noticed that with cigarette packaging, which a lot of people have made a connection with, that eventually over the years, the cigarette package warning got larger and larger and larger. And I was wondering if they had, if any, there was any connection to the size of the warning versus to people choosing not to consume the beverage.
I think this is a great question, and the fact that we have some of the best labeling on our tobacco products can definitely lend as an example as far as we know pictures are better. We know that bright colors help catch people's attention. So you saw the labels in the Yukon study were bright yellow and bright red. And so as far as size, you know that they need to be big enough to be properly seen and read. It is a bit of a give and take with manufacturers and businesses and what there's space for. But it is exciting that we are not starting from scratch and we can build off of, like I said, best practices that we already know work based on other products that we're labeling in Canada.
Excellent. Once again, any questions, you can put them into the menu on the side. My second question actually is alcohol and cancer recurrence. When we're talking about consuming alcohol, I mean, I know a lot of us survivors, they just basically say no to it because they want to stay cancer free. But what kind of information can you share about alcohol consumption and recurrence when it comes to people who have survived cancer?
Yeah, something that's really heartbreaking to me is that many people that I've been speaking to have been saying that they don't have any awareness of the link between alcohol and cancer until they're in the oncologist's office being told by, like, upon diagnosis that, oh, this is a modifiable cancer risk factor. And that's super unfair and just not appropriate, and part of the motivation for bringing alcohol warning labels so that at the point of purchase, at the point of pour, we have information to make choices. Many oncologists will recommend that cancer patients reduce or refrain from drinking alcohol. Ultimately, it's a personal decision, and continuing to uphold that kind of as you go through your recovery and survivorship. But it's not easy, and I think that there's so many things that we can be doing as a society to make it more normal and more okay to refrain from drinking alcohol on any given occasion or in general, because it's one of the few substances where there's actually a reverse stigma. We don't shame people for consuming alcohol, which I'm not saying we should do anyway, but we actually shame people if they don't, right? What do you mean you're not drinking? Oh, come on, just have one. Or are you pregnant? Or like as if you had to have a reason not to consume. But you know, the fact that you don't want to is enough. And if we all understood a little bit better some of the health implications, more people might choose that as a valid option, and it is totally valid. So bringing that to this message is an important one.
Now, my final question on my part, when you were doing these studies, you said that there was kind of a blowback from the industry. What kind of has been the relationship and the reception of the alcohol industry to these findings?
Yeah, we know that it is not in their favor. A lot of industry is against labeling. They're against many of the policies that we would be looking towards in the long term, as far as, you know, whether we're looking at cost or availability, accessibility, that sort of thing. Marketing is another huge one. And they often have a really large voice with government officials. We often hear when we work with government that, you know, it's hard right now. There's not a lot of political or public support for these sorts of initiatives. And so the more we can be doing to raise awareness, help understanding, and make it easier for parliamentarians and like government officials to support implementing policies that would really make these environments just healthier for all of us and easier for us to make some of these decisions would be huge. And And so I think this is a great first step as far as being part of panels like this or conversations like this, and trying to advocate for policies that would just get that information into people's hands. Like I said, at the point of pour, at the point of purchase, we all deserve to be able to make that informed choice for ourselves.
Mary's asking, can you get more into the science behind alcohol and negative health effects? For example, the chemistry, whether ethanol molecules bind to cells or cause them to mutate.
This is definitely beyond my expertise, and so like would have to refer to researchers and scientists to get into the nitty-gritty of that all. But the science is very clear. It's been clear for a while, to be honest. It's taken time to really create the momentum that we've seen today, and I think that's really positive. Even in the last couple of years that I've been advocating on this issue, I'm seeing tides turning. I'm seeing our environments turning. As far as more options, we're seeing more non-alcoholic options. We're like in restaurants and bars, at events, and more awareness of some of the different health impacts, whether it was in relation to the release of Canada's guidance on alcohol and health, or fundraisers like our own, or webinars like this. So we're well on our way. And if you're curious to learn really that science background, it is there for you, and there's tons of articles I'm sure we can circulate via the Canadian Cancer Survivor Network.
And Marie had a comment. It's really encouraging that there has been a recent proliferation in non-alcoholic beverage options in grocery stores, but also in restaurants or at concerts, etc. I don't know if it's something that you would like to speak to, Sienna.
I'd be happy to. Yeah, I think that the number one thing is that it's not a silver bullet. Some of the concerns that we're hearing are around sugar content, or you know, the fact that companies who sell alcohol are still able to perpetuate their brand and are actually able to get into spaces that maybe they weren't allowed before because they're selling non-alcoholic products. So I think it's important that we continue to welcome research in this space. We've also heard great things about people being able to replace alcoholic beverages with non-alcoholic beverages and cut back in that way. I think also the options are so much better than they used to be. You used to hear non-alcoholic beer and think, gosh, that must be terrible. But now if you try them, there's local craft brews that are also doing things so you can support local business, small business. You can lower your alcohol content kind of all in one go. And I think that just having lots of options is a great way forward, and demonstrates that the alcohol industry itself sees where this is going, sees that there is momentum, there is desire and interest in the general public for this kind of product. So I think it's great that it's being made available, as you said, at concerts, in restaurants, and different sorts of events. So I'm excited about it. I think it's overall good news, but continuing to look at the research for sure.
Excellent. Well, thank you very much for the presentation. It was great to see everything. And again, if they're able to contact you with any questions, they can be sent your way by email and the information that you have, correct?
Absolutely. I would love to hear from anybody who's interested in learning more, chatting, always up for a conversation, or to hear your own experience if you've got a story to tell that's in relation to any of this, really. I think that the voice of people living with and beyond cancer have a role to play in helping to bring this forward, and in telling your stories to parliamentarians, to your representatives, to government. Those are really, really impactful. We just had a day on the Hill a few weeks ago, and it really breathes life into why we're asking for this and makes it so much more personal. So I think that you and your viewers have a really important role to play in bringing this sort of thing to fruition, and ultimately making Canada a bit of a healthier place in regards to alcohol consumption and cancer risk. So just grateful for all of you and your interest. Really appreciate it.
Excellent. Well, thank you very much, Deanna. It was a fantastic presentation. And that's all the time that we have for today. Once again, if you want to keep in the loop about our webinars, you can subscribe to our newsletter and to our email list. Check your inbox to make sure you're still getting it. And if you're not, just head on over to our website and where you can subscribe there. Now, this webinar and all others can be found on our website, survivornet.ca/webinars, and they can also be found on our YouTube channel. So with that, thank you very much, Deanna, and everyone else have a fantastic day as well.